health alert that could change your medicine and your life. More than 30 million Americans already take statins to lower their cholesterol, but because of the news tonight about heart attacks and stroke, that number could double. And ABC's medical editor, Dr. Richard Besser, now on what's coming.
They're life-saving drugs, the best we have for lowering the risks of heart attacks and strokes, statins. Today, new guidelines that dramatically expand our use to 1/3 of all adults.
We've always treated people that have had a heart attack or a stroke. We're now going to be treating many millions more people who have not yet had a first event. That's a very big deal.
Among the changes, statins will now be recommended for all people with type 2 diabetes aged 40 to 75, regardless of cholesterol. The old guidelines recommended a statin if your risk of having a heart attack over the next 10 years was 20%. The new guidelines also look at race and sex and recommend statins if your risk is just 7.5%. For example, yesterday, a 55-year-old African-American woman with normal cholesterol and high blood pressure would not go on a statin. Today, she would.
Treating more people makes sense. It's important, however, that we treat the right people. And our own Rich Besser is here. Rich, 1/3 of all adults in this country on prescription medication. Does this give you pause?
I mean, it really does. In general, statins are very safe. Some people are going to have muscle pain. Some may have increase in diabetes. But if you're someone who has a low risk to begin with, you have to decide, is it worth it? Do I want to go on a drug for the rest of my life to lower it just a little bit more?
And there are interactions with these drugs you have to be careful about?
Yeah, there are many drug interactions, so if you're starting on this new, you have to check for those. And even something as simple as grapefruit juice is something you have to avoid if you're going on statins.
Right, so do not self-medicate.
Exactly.
Okay, thank you, Dr. Richard Besser.